Evenity romosozumab is a sclerostin inhibitor indicated for the treatment of osteoporosis in postmenopausal women at high risk for fracture, defined as a history of osteoporotic fracture, or multiple risk factors for fracture, or patients who have failed or are intolerant to other available osteoporosis therapy. How to use? The recommended dose of Evenity is 210 mg administered subcutaneously in the abdomen, thigh, or upper arm. Administer Evenity once every month. The treatment duration for Evenity is 12 monthly doses. Patients should be adequately supplemented with calcium and vitamin D during treatment with Evenity. If the Evenity dose is missed, administer as soon as it can be rescheduled. Thereafter, Evenity can be scheduled every month from the date of the last dose. Step 1. Prior to administration. Remove 2 syringes from the carton. Visually inspect Evenity for particles and discoloration prior to administration. Evenity is a clear to opalescent, colorless to light yellow solution. Don't use if the solution is clouded or discolored or contains particles. Don't use a syringe if any part appears cracked or broken. The gray needle cap is missing or not securely attached. The expiration date printed on the label has passed. Always hold the profiled syringe by the syringe barrel to remove the syringe from the tray. Do not grasp the plunger rod. Do not grasp the gray needle cap. Do not remove the gray needle cap until you are ready to inject. Allow Evenity to sit at room temperature for at least 30 minutes before injecting. Don't warm in any other way. Step 2. Select the injection site and prepare the syringe. Prepare and clean 2 injection sites, one for each of the 2 injections. The recommended subcutaneous injection sites include one thigh, abdomen, except for a 2-inch area right around the navel. Outer area of upper arm. Clean the injection sites with alcohol wipes. Let the skin dry. Choose a different site each time you give an injection. If you want to use the same injection site, make sure it is not the same spot of the injection site you used for a previous injection. Do not inject into areas where the skin is tender, bruised, red, or hot. Avoid injecting into areas with scars or stretch marks. Choose the first syringe. Pull the gray needle cap straight off and away from your body when you are ready to inject. Do not put the gray needle cap back onto the syringe. Step 3. Inject Evenity. Insert needle and eject all the liquid subcutaneously. Don't administer into muscle or blood vessel. When done, gently lift the syringe off the skin. Step 4. Syringe and needle cap disposal. Immediately dispose of the syringe and needle cap in the nearest sharp container. Important, repeat all steps with the second syringe to inject the full dose. Contraindications. Evenity is contraindicated in patients with hypocalcemia. Pre-existing hypocalcemia must be corrected prior to initiating therapy with Evenity. A history of systemic hypersensitivity to romosozumab or to any component of the product formulation. Reactions have included angioedema, erythema multiforme, and urticaria. Possible side effects. Local medicine. This medicine can cause side effects. Although not everybody gets them. Seek medical attention straight away if you get any of the following possible symptoms of heart attack or stroke. Uncommon may affect up to 1 in 100 people. Chest pain, shortness of breath, headache, numbness or weakness in the face, arms or legs, difficulty talking, changes in vision, loss of balance. Seek medical attention straight away if you get the following symptoms of a serious allergic reaction. Rare, may affect up to 1 in 1000 people. Swelling of the face, mouth, throat, hands, feet, ankles, lower legs, angioedema or hives. Acute skin eruption showing multiple round, red, pink spots with a blistering or crusting centra, erythema multiforme. Difficulty in swallowing or breathing.